Good afternoon, everyone. I'm Chia. I'm from Focus Point. I'm the head of training and development. So my topic for today will be the importance of comprehensive and regular eye check in the elderly population. So this is my opening slide. So my name is Chia. Allow me to briefly introduce myself. I'm with Focus Point for about 2 years now. So my experiences include lecturing for SAGI, lecturing for UCSI. I've also done training for Bosch and Lomb. For Bolton Optical Group, which is a smaller optical group of 50 outlets. So I did my bachelor's degree, my first degree with UKM, and subsequently I also went back to do my master's in 2011. So that's a bit about me. So as we grow older, our eye change. So there's aging in the eye. Our eye 老化 lah, so becomes older. So we actually have loss of eyelid elasticity. You find that some old people, their eyelid are droopy. It's like sleepy eye. We also find that our eye is easily red when we grow older because it becomes slightly drier. And tear volume decrease. So our tears also become less because of the production, and our pupil becomes small. Sometimes if you want to fit certain lenses like multifocal contact lenses, it becomes more challenging. And lastly, our lens deposits, so we start to develop something what we call like cataract or selaput. So generally, when we grow older, we are more susceptible to conditions. One of it is 老花眼, which is presbyopia. So what happens in presbyopia is we start to see blur at near. Maybe if you want to read the medication bottle instruction, you find it more difficult. Like maybe if you want to look at your handphone, you find that it's more challenging. So those are some of the things that you will face. So normally presbyopia or 老花眼 happens when you turn about 40. At this area in the this Asian region is about 40 years old that you start to complain not being able to see maybe the lines on your hand or your handphone. So that's one. So for 老花眼, what other things we will face is we have difficulty, like if you're having a candlelight dinner, then you find that the menu is a bit blurred because when it's dark, it's harder to read.
I think
So-
it's really related because my mom has that problem as well. When
Yeah,
it's just
yeah.
reading, the menu from a very dark environment, I bring her to to have a dinner at a very
Like
kind of
very
bit-
high class
yeah, very high
restaurant,
yes, yes,
it's
yes.
darker,
Yes,
the
so my-
lights are orange.
Yes, my
so
mom
it's a
always
bit more
passed me the
difficult.
menu. Can you just order anyone for me? I cannot read now. It's
Yeah,
like
yeah, I totally understand.
It's very
that. I'm
relatable.
going there as well. Yeah, I totally understand your mother. So yeah, so candlelight dinner menu reading is difficult and challenging. So what they can actually do is they can actually use a torchlight. Maybe they can keep a small torchlight. Maybe use their handphone torchlight, or they can use a magnifying glass. So all those things will help. So for presbyopia, what the most common thing we normally do is we go for glasses, maybe the reading glasses. Some people they upgrade their glasses to multifocal progressive lenses so that they can see both far and near and don't have to remove their glasses when they read at near. So that's the normal thing that we do. Of course, there are also other things like that is like LASIK surgery that can correct presbyopia, contact lenses that can correct presbyopia, and also glasses that can correct presbyopia, surgery as well. So there are many options. So when you grow older, we are also more susceptible to a condition called 白内障. 白内障 is cataract in English and selaput in Malay. So this is also a condition that's very common. The lens start to age, so it becomes white, opaque, and you start to see blur. So this one, the only solution is for you to go through the surgery if you find that your vision is starting to lose out when you actually develop cataract. So this is a very common condition, and cataract is especially common, especially if you are over 60 years old. So some people develop cataract earlier. So these people are maybe if you have diabetes and it's poorly controlled, your cataract may come earlier than 60 years old. So also if you are on certain medication like steroids, then you tend to get cataract earlier as well. So a very good example will be from our previous roadshow in IOI City Mall. we had two ladies in their 30s who developed cataract. So they are using steroid creams for eczema. 皮肤敏感.
I see.
Yeah, so it's something like an allergic, it's a skin condition. So they're using as steroids to reduce the reaction of the skin. So they've been using it for more than 20 years and they developed cataract in their 30s.
I see. I now I only found the reason why because when we have the skin problem, I had the skin problem as well, and I went to the doctor and they said please do not close because this medication is actually it has the steroid in that, and he told me not to use it too close to your eyes. I found out that's a problem. So you will develop that the cataract as well.
So yeah, actually this cataract picture is from IOI City Mall.
I see.
It's one of the patients that we caught having cataract in IOI City Mall. But this one, she's actually queuing for the surgery at Hospital Kajang. She's supposed to have a cataract removal in October this year. Yeah.
I see. So what are you gonna do when we have these symptoms of the cataract? It's like the only option is that we go for the surgery.
Yes, if it's really disturbing, you can go for the surgery. If it is like if you go to the government, it needs to be a certain level of blur. If you go to the private, any level of blur, the doctor will operate for you. As long as you come to an agreement with the doctor that is disturbing your day-to-day activity, then the doctor will operate for you.
I see. All right. It's quite disturbing when you see the white spot. It's like blocking your vision.
If it's in the center, it's quite disturbing.
Quite disturbing.
But some old people, they have it by the side, so it can be very thick and not disturb your vision because it's at the side.
I see.
So it depends on where the cataract is also. Like this one is quite disturbing because it's right in the center. Yeah.
All right.
Yeah. So and also when you age, you are also more susceptible to a condition called glaucoma, which is 青光眼. So it's a condition where your eye pressure is on the high side, is causing damage to your nerve. So this can slowly make you go blind. So what we normally do is we will screen for your eye pressure, 眼压 or your tekanan mata, and we will also screen inside your eye whether there's any cupping. That's a cupping. So the bright area is very large. So that's what we will do lah. So we want to detect or catch this glaucoma early. Reason is because after 40 years old, your risk of glaucoma becomes higher. So we want to catch it early so that it doesn't damage any nerve, so that we can start you on drops to control the eye pressure.
I see. So do we have any solution for this surgery as well?
Normally we will start with drops. If the drops cannot control the pressure, then have to go for surgery.
I see. All right.
Yeah, so after 40, this is one of the conditions that is very common. So we would screen for that as well. That's why, like 40 years old, you start to get presbyopia, higher risk of glaucoma. So these are some of the reasons why you should come for an eye check once a year at least.
All right.
Yeah. So the next condition is age-related macular degeneration. Okay, very long name. This is 老年性黄斑部病变 in Chinese. So yeah. Normally when I talk to customer, I say 黄斑部病变 lah because this is too long. Yeah, but basically it's changes to the macula, the sharpest point of vision. This one normally above 60 or 65. So what happens is the vision will start to blur and you start to lose the central vision. Meaning like if I look at you, I cannot see your face. This is age-related macular degeneration. So, but one thing to be happy about is it's not so common in Asians. It's more common in Caucasians.
Oh, why?
Yeah.
Does there any reason behind it?
I think partly genetic and
Partly
also
genetic.
less pigmentation. Yeah.
I see.
They are fairer. Yeah. So,
Lucky to be Asian now.
yeah, but this is one of the causes is aging. So normally if there's anything related to like any yellow spots around, then we would maybe ask them to take some supplements to slow down the aging of the eye.
I see.
Yeah. So this is age-related macular degeneration. Next up, we have diabetic retinopathy. So did you know that actually diabetes can actually affect and cause blindness?
I really have no idea about it.
Yes,
First
so
time I.
diabetes, the control is very important. It's very closely related to the eye. If your control is no good, it can actually go in the eye. It can actually cause leakage, bleeding, 流脓流血. So
Oh.
leakage, bleeding, then you can see like that is bleeding, yellow spots, all those. So it can actually cause changes to small vessels, which is the vessels within the eye, the blood, the 血管, blood vessels within the eye. So diabetic retinopathy is something very common in Malaysia. As you can see, this is in 2010. Something published by the government, the Ministry of Health. Malaysia is actually the most
highest
diabetic
one.
region in Southeast Asia.
Oh wow.
So we have the most patients with diabetes.
I
so
see.
our diabetic retinopathy is, if I'm not wrong, third or fourth cause of blindness, highest cause of blindness in Malaysia.
I see.
Yeah.
All right. So diabetes is not only causing like you have to cut off your legs, you know.
Yeah, it will also
affect
affect
the eye as well.
Yes.
All right.
So you can go blind if you don't control your diabetes properly.
But this one is
So-
like you have to get the diabetes only you have this problem, or it's like what is the sequence? You only get that only you get diabetes, or when you
No,
consume too much of
get
sugar.
diabetes is if it's poor control, then you will
You-
develop this.
I see. All right.
So it's diabetic retinopathy is a retinopathy, which is a 病变, 视网膜病变 that is caused by diabetic.
I see.
Yeah.
All right.
So this is the next condition. So next we have dry eyes. So as we grow older, our structures, our organs tend to function less effectively. So happen that our tear glands have this change as well. So we have meibomian glands, lacrimal glands. All these are glands that actually, the organs that actually produce tears. So their function is not as good as the young people. So what happens is you tend to get less tear volume, unstable tears, so your eye develop dryness.
Okay.
Yeah,
so
so
which
this
means like
can
it's not
happen
much. It's
also.
not moisture
Yeah,
than
it's not
previous one.
lubricated and as moisture as young people. So you tend to end up with dry eye. So you will need like if your hand is dry, you need to apply lotion. So when your eye is dry, you need to apply eye drops.
I see.
So normally we advise for preservative-free artificial tears to counter for this problem. Yeah,
I see.
yeah. So that's why a lot of people, they wear contact lenses. As they grow older, they find that it's harder to wear contact lenses because it becomes more uncomfortable, partly because the eye becomes drier. Yeah.
I see.
Okay, and yeah. So this is a concluding slide. So we have a few conditions like presbyopia, we have cataract, we have age-related macular degeneration, we have dry eyes, diabetic retinopathy. All these are very common conditions that can affect elderly. So if you have certain conditions, maybe you have to come for an eye check every 6 months. And if you are generally normal but above 40, you need to check your eyes once a year. So this is a video from Focus Point. This is our eye check procedures. So normally when you come in, we check your, we go through your history. So like certain conditions like glaucoma, diabetes, it runs in the family, it's genetic. So we need to pay extra attention to the test. Then we also have refraction, binocular vision, color vision to screen for a lot of different abnormalities and diseases. Yeah, now refraction will basically tell us whether the power fluctuates like cataract. The power will be unstable. Yeah, so that is important. Anterior eye assessment, the slit lamp will actually help to detect conditions like dry eye and cataract. Then eye pressure will actually screen for the eye pressure, so see whether there is any higher risk of glaucoma. And retinal screening will actually look at the back part of your eye. So
I
like
see.
diabetic retinopathy, age-related macular degeneration, we will actually see those conditions through the retinal screening. And lastly, to sum up, to conclude, we will give you a very good consultation to help you understand and understand your eye better. So do visit us. We have more than 190 optometrists in Focus Point. So you can actually visit our APEC outlet, our Focus Point optometrists to have a comprehensive eye exam at least once a year if you are normal and over 40 years old.
Which means the service is actually available at all the focus point outlet, right? Isn't it?
Most of them,
Most
yes.
of them. I
so
see.
At the moment we have 200 outlets,
Mm-hmm.
about 200, about 65 is franchise, the rest is all wholly owned. So about 85 of our wholly owned outlets have the full set of instrument.
I
But
see.
our optometrist number is exceeding 190 at the moment. So you can actually see a professional optometrist at almost every focus point outlets now.
Mhm.
Yes.
And what is the good news, ladies and gentlemen, is that we have the free eye screening here as well. Like what we
Yes.
mentioned here, it's
Yes.
free, right? Upon registration here, and where you can see there's station 1, 2, 3, 4 right there. It's all free right now to do the 360. I would say the comprehensive kind of the eye test is
Yes.
free here today, so you don't have to pay to any visit here. If you so happen to walk by here, yes, you got a chance to get yourself a free eye check here.
Yes, we
It's
will
free.
be here
Yes.
till 4th of August
Tomorrow.
in IOI Mall Puchong. So you can still drop by and visit us for the free comprehensive eye test.
Right. Thank you, Miss Chia. Thank you so much. I
Okay,
really learned
thank you,
something.
MC. Yes.
I learned something new today, to be honest. I didn't know
Yes.
that we actually need an eye checking, to be honest, because maybe I haven't had that any issue of you that you mentioned just now.
Yes.
But I do really learn something is that when it comes to certain part of the age or when you
Yeah.
aging. All right, it's like our body as well. We do body checkout every year, but I didn't know that eye is like something we really have to take care about.
Yeah,
It's really,
eye is the window to your soul. Actually,
Yes.
there's a lot of conditions or problems that you can detect from the eye.
Yes,
Like
it-
some people, they do not know they have diabetes, but we detect diabetic retinopathy. So they go and check their blood and they found out actually they have diabetes for very long already. So it's, yeah.
It's
And
one of the
also
worry-
It's also a very important organ,
Organ,
because
yes.
it helps you see the world.
to connect the world,
Yes,
to connect the people.
to
Yes.
learn, to connect with the world. So if you actually lose your vision or your sight, it's actually very detrimental to your health, your well-being, and your mental state.
Let's
Yeah.
imagine you cannot see your grandchild anymore.
Yes.
It's really sad. Yeah.
Yes, you cannot see someone smiling with you.
Yeah,
to you
that's right,
anymore.
that's right, yeah.
It's something very sad. So we should all work hard on preserving our eyesight, especially when you grow older, when you have higher chance of getting diseases.
So I'm gonna just do a short sum up and a summary like what we learned today. Okay, all these symptoms is actually caused by aging.
Yes.
Okay, it's when we age, our organ doesn't function well anymore.
Yes.
Same goes to our eye as well. You will actually like encounter like lots of eye disease and issues. So, Miss Chia, the piece of advice is that you have to do the checkout at least once a year.
Yes,
all
at
right?
least once
and
a
the
year.
service is actually available at Focus Point outlet. Most of the
And-
outlet, yes.
Yes, and we are providing it free of charge, so you can visit any
Oh,
one
it's
of our outlets.
free of charge as well.
Yes, it's free of charge.
It's free of charge for every outlet, right?
yes.
Yes. All right. Oh, that's great. That's great. All right.
Yes, eye check is free in Focus Point.
Eye check is free, but don't forget, guys, because we have the eye screening. How check is here for free as well.
yes,
All right.
Yes, yes.
All right. Once again, thank you, Miss Shah. Thank you so much for
you,
the
MC.
amazing
Thank you,
sharing.
MC.
We learned a lot today. Thank you so much.
Yes, thank you. Same to you.